In this age, VR is one of the most amazing technologies that we can rely on. Interesting part about VR is the fact that it's not only used for fun and games, but it's also used for medical causes as well. Virtual reality therapy is the use of this technology for therapy and affecting virtual rehabilitation. But how does it work? VR therapy works by allowing people to act out, practice, or revisit situations in a safe environment by using a computer-simulated world as a treatment tool. Some people might use it to practice new skills, face fear in a safe environment, or become more confident in social interactions. But remember, VR therapy does not replace standard treatments for mental health conditions. Instead, most clinicians use it as an additional treatment. It is possible to simulate a wide variety of worlds and scenarios with VR, which makes it useful for constructing situations that are hard to recreate in real life. Therapists originally used VR therapy to treat phobias, but over time, they have tried it for a variety of mental health conditions including anxiety, depression, and post-traumatic stress disorder, PTSD. Now, let's see how VR can help with different mental disorders. Phobias. Therapists can use VR for exposure therapy, which is a mainstay of phobia treatment. It involves gradually exposing a person to what they fear in small, manageable steps with their consent. Interacting with a simulation in VR may help them gradually become accustomed to the object of their fear and learn it is not a threat. PTSD. Exposure therapy can also help treat PTSD. But as with phobias, controlled exposure to a traumatic situation can be difficult. The studies show VR therapy reduced PTSD symptoms, and the benefits continued for at least 3 months after the treatment ended. Anxiety. For anxiety, there are some rhythm-based VR games where players engage in a stress-relieving experience. Anxiety-relieving games, whether experienced through the convenience of mobile gaming or the power of virtual reality, offer a unique and effective way to soothe the mind. ADHD. For ADHD, virtual reality technology could be used to help detect ADHD, as well as train people with ADHD in skills like memory and concentration. Research showed people did better on tasks that required attention when using VR. Depression. VR unique experiences can be put to antidepressive use. What we found is that using virtual reality in an outpatient group of patients is both simple and efficacious in treating symptoms of depression. Many people who had used the VR devices said the virtual activities had helped push them to get out of the house and be more involved in in-person activities. Dementia. Studies show that VR can potentially enhance memory, focus, puzzle solving, and speech in those with dementia. For instance, a VR museum tour allowed residents to retain more information about the exhibits compared to those who viewed images on a 2D screen. These are some of the ways that VR therapy can help anyone with mental health disorders. Thanks for staying till the end of this video. Don't forget to like and subscribe to our channel. Stay healthy and see you in the next video.